Good evening, everyone. My name is Helen Vu, and on behalf of Atrium Innovations, I welcome you to this evening's webinar on the Unda numbered compounds, session number 4 with Dr. Dixon Tom. The audio portion of this webinar is now available via voice over IP ROP or a telephone conference, and questions will be submitted via the Q&A panel. This is the only forum for questions this evening. Also, in regards to the promotion, before passing the call to Dr. Tom, I would like to encourage you to take advantage of the discount of 15% off all on our Unda numbers, valid until June 8th, and this can be used 4 times during the duration, and the promo code is UNDA20 and qualifies for free shipping. I'd also like to highlight a few aspects of our 2020 education program as webinars. Firstly, there is a webinar with Dr. Michael Adams on September 23rd on metabolic balance, a clinical focus addressing the burden of environmental MDSs. Also, the second one is with Dr. Felice Gersh, a medical doctor, as follows on October 28th, estrogen, why women love it and how to keep it longer, the nutrition approach to prolong ovarian function, and also on November 4th as well, the PCOS, the most common endocrine disorder of women, new integrative understanding and therapeutic approaches. And now I'd like to introduce you to Dr. Dixon Tom, a little bio. Dr. Tom is one of the founders of the American Cancer for Biological Medicine in Scottsdale, Arizona. He is a graduate of the University of Toronto Dentistry in 1974, the Ontario College of Naturopathic Medicine in Toronto, ND title in 1986, and the National College of Naturopathic Medicine in Portland, ND title in 1989. He has been in medical practice for over 50 years, initially as a dentist, but for the last 34 years as a naturopathic doctor with a primary focus on the management of chronic disease, including autoimmune, neurological, gastrointestinal, and endocrine disorders. As a professor, former dean, and he has lectured internationally on the topic of drainage, business, and health for the last 40 years. Please now join me in welcome Dr. Tom.
Thanks very much, Ellen. Good evening, everybody. We trust everybody is in a safe place and ready to hopefully receive more information that we have to share this evening. I found this slide some time ago when I was talking to my grandchildren, who at the time were 4, and I thought it was so great. Geez, Grandma, it's not that hard. Go to settings, select Wi-Fi, select it, tap it with your finger. Oh my God, any finger. So it's kind of the case of our society now where, the aspect of children seem to have the real ability to handle this technology stuff. So this evening, what we're going to talk about, the systems that we're going to talk about are the digestive system, and respiratory system, which are a couple of the systems that have potentially the most Unda numbers that you can mix and match when selecting, your organ system. So there's many combinations that we can use in those 2 specific systems, as well as the nervous system this evening. So as a reminder, and this, we'll say it every time, and I have to say that this slide number 5 is probably the one that people who are new to the concepts of drainage or new to the concepts of, supporting how the body is healing have the most challenging time. A reminder, and when we get into the cases, once again, I'll say it again and I'll say it again, that Unda numbers are used to restore balance to the organ systems. They're not designed to treat diseases. They're not designed to treat symptoms. They're designed to recreate physiology, biochemistry, and physics in a natural way that the body has been designed to work throughout the centuries that we've been on this planet. So we don't treat conditions, we don't treat diseases. We basically manage natural laws, we manage natural physiology, physics, and biochemistry. So the most important aspect for the success of Unda numbers, and there's a case we're going to go over this evening, that is the perfect representation of if you don't approach it from a systems, an organ systems way, you're probably not going to be successful. And if I've heard it once, I've heard it 1,000 times in the last 20-plus years that I've used Unda numbers. Oh, I tried Unda numbers and they didn't work. No, Unda numbers always work. What doesn't work is your case management. What isn't working is the understanding of the physiology, of which of the organ systems are we truly treating, of how do all these systems interact. And, underlying all this, once again, in addition to the word physiology in the middle of the slide, we could put biochemistry and physics, because that's really how the body works. I know we have a lot of research in attempting to find X, Y, and Z, or to promote. And the questions that I've received often from between each of these sessions is, I have a patient with condition X, how do you treat it? And my answer is always the same. I don't know how to treat it, because I don't know what system you basically have been tried to support. This is an important slide on number 7. It's critical that you appreciate that our organs mature at different ages, and of course they continue to reproduce. The cells turn over, as you know, at different periods of time, different lengths of time. The cells in the eye being the quickest, probably followed by the digestive system. Unfortunately, the ones that are the slowest are the nervous system. And so with this, and if this slide number 7 is unfamiliar to you, please go back and review session 1. In fact, I'm going to recommend you review these sessions more than once. You may be at home now more and have some more time to be able to do that, because each time you listen to it and create an understanding, you'll get a better understanding of how the body is working. And there's a huge component of physiology that's related in this particular slide. And as a reminder, if we just look at, if you think of CPR, what are we really talking about? We're talking about chest compressions, or we're talking about oxygen. So we see on those two overlapping triangles, respiratory is in one corner, and the direct opposite in the other triangle is the cardiovascular system. So that's how these 6 systems overlap each other. So, you may realize that you have to treat a respiratory issue, not with respiratory Unda numbers, but rather with cardiovascular Unda numbers. And you'll see in a case this evening how that comes to play. We can say the same thing for kidney, adrenal, for nervous system, for GI or endocrine. You have to look at how these all interrelate. And in fact, we may treat any of these with an exact opposite. And if we gave a case, for example, of fatigue, and say, okay, which organ system do you want to treat? You'd look at that slide and you'd say, it could be any one of them. And you're right, it could be any one of them. So people say, oh, fatigue. Oh, the first thing we think about, it must be adrenal fatigue. Well, maybe it isn't. It must be thyroid problems. Well, maybe it isn't. So maybe it's not the endocrine system at all. Maybe it's a respiratory problem because they simply have a low pulse oxygen. They're not getting enough oxygen in to supply their mitochondria. Or maybe it's a central nervous system problem because they're not sleeping and they have sleep apnea, and et cetera. So it's a cardiovascular problem and they have hypertension. So fatigue is any organ system. You can use, obviously we use Unda numbers to support that. However, you need to be careful of just making an assumption that the reason people have fatigue is the ones that we always say about, oh, you have more stress, this type of thing. That's what you would end up doing. So just a reminder that particular slide is absolutely critical. So we're going to start off talking about the GI system. Slide number 10 is, once again, how I've laid it out in that little table is your organ remedies, once again, between numbers 1 to 13. remembering that all those organ remedies have a metal or more metals associated with it. And when you do your system evaluation, your organ system, and decide that indeed the complaints of what the patient is presenting with is a digestive problem, then when we pick an organ remedy, we will either pick 3, 4, or 6 because that's the organ remedy that's specifically related to the digestive system. It doesn't mean, however, that all problems within the digestive system should be given 3, 4, or 6 because the problem may be manifesting from another organ system, but just the symptom is showing up in the digestive system. So you'll remember that Unda number 3 is for everything below the pyloric sphincter with one exception, that exception being duodenal ulcers, which is Unda 4. So Unda 4 is everything above the pyloric sphincter, which means the stomach, the esophagus, the oral cavity, and the one exception is ulcers, both peptic ulcers, duodenal ulcers, and stomach ulcers, peptic ulcers. Unda number 6 is the large intestine. For the most part, we tend to think of Unda 6 in the cases of holding on is a word I prefer. Yes, it's used for constipation, but I would say 9 times out of 10 in the last 20 years that I've used Unda 6, it's not been for constipation because the key emotional component of Unda number 6 is holding on, what we call the hoarder, the pack rat, the inability to let go of something, whether it's a physical thing or an emotional thing. I've used Unda 6, for example, in a divorce, in a woman who was getting a divorce and was incredibly bitter with what the arrangement was and just couldn't let it go and had lots of GI problems, but lots of sleep problems, etc. But she wasn't constipated, interestingly. But what she couldn't let go of was the emotional aspect of, the bitterness of what was happening in this divorce settlement. So remember, each of these remedies have more utilization than just what's sort of on this chart, but that's the summary for those particular remedies. When we look at the functional remedies, remember the functional remedies for the most part are the remedies between Unda number 17 and Unda number 50. Once again, with one exception, those remedies all have 1, 2, 3, or in the case of Unda 20, 4 metals in them. And the metals, once again, the purpose of the metals is to activate enzyme systems within the specific organ systems. The function of the plants that are associated with each of the Unda numbers have this organic trophic effect, so they literally pull the metal to the specific organ site that we're trying to treat. Unda 17 is often remedies that are used when there's some GI issues and some skin issues, which just says, oh, that sounds like atopic dermatitis, for an example. Oh, would that be an ideal remedy for a child? It would be if there's a GI and the typical spots on the elbows, elbow creases behind the ears where we typically see atopic dermatitis in children. Unda 24 is a favorite remedy. It is absolutely not limited to the digestive system. In fact, you can put Unda number 24 in every single organ system. If we go back to the physiology, every single organ system has a utilization for number 24, even though we talk about it, digestive systems from stress, digestive systems from an emotional aspect. But that applies to, you could have heart palpitations, and even though, it doesn't have to be listed under cardiac, it is a cardiac remedy if palpitations are due to increased stress of the individual. But whether it's breathing problems, whether it's insomnia problems. So 24 is a very big, all-inclusive remedy. It's absolutely one of the ones you need to have in your medicinary because there isn't any patient, especially in this day and age, that Unda 24 wouldn't be helpful for almost no matter what their initial presentation is. Unda 26 is a less common remedy. It's more specific in the dental field, we'll say, because it's more specific to gingivitis. We know that there's potentially over 400 different conditions that show up in the oral cavity. And if you're specifically dealing with, whether it's aphthous ulcers or even dental caries, but often it's, poor digestion shows up as coating on the tongue. Unda 26 would be useful in that arena. And Unda 31 is a smaller use remedy, more often used for ulcers specifically, or it could be used for GERD even if there's a lot of reflux that the patient is experiencing. So, it works. I mean, all these remedies, when you choose the right system for what it is you're supporting, physiology, physics, and biochemistry, these remedies work often within one dose, or can work within one dose, but obviously we don't just give them one dose. Unda 34 is the male hormone remedy. It's also for pancreas and the digestive system. So it's, even though we don't specifically have a number between 1 and 13 that fits the male, unlike the female, it can be useful in that. It's also a very important remedy for the adrenal and the pancreas perspective. Continuing the functional complexes on the next slide, Unda 39 is dysbiosis, parasites. Somebody who's been to Mexico and comes back, and no sooner are they back, they're having pretty severe diarrhea, or if they travel to a foreign country and they're having, they don't have to travel to a foreign country, of course, to pick up some type of a bug within their system. But if there's anything from however you make your diagnosis methods, Unda 39 is useful in that particular arena. 43 and 46 have somewhat of a similar action. They definitely are upper GI for the most part. Upper GI from bloating, from belching, would be a GERD remedy is commonly what it's given for. There's a heaviness that what goes along with Unda number 4, which is that it feels like you ate too much. Things just sit there and don't digest well. 43 and 46, somewhat interchangeable. I tend to use 43 more than 46, probably just habit more than any other reason. 50 is one of the other remedies that every patient, sort of like 24 and Unda 3, that at some point in your therapy would choose to be helpful. It's everything within the GI tract from a colon health perspective. If we go back to slide 10 and go into the drainage remedies, remember most of these, with a couple of exceptions, are remedies that don't have the metals, so what they're part of the organotrophic effect that we combine, because we are once again ideally picking 3 remedies, 1 remedy from the organs or the systemic, 1 remedy from the functional, and 1 remedy from the drainage, and they more or less are supporting. And so we're getting additional organotrophic remedies to pull the metals from the systemic and the functional complex to the site of action to change the physiology, biochemistry, and physics within the tissue. 74 is portal hypertension. This has a lot of liver congestion that's often associated with it. Can also be used cardiovascular, as we talked about previously. 210 is sort of the sister, I'll say, of Unda 24. In fact, I don't very often use 24 and 210 together unless we have a pretty dramatic aspect of the overwhelming component of, they're having panic attacks 3 times a week, or they can't sleep because they have tremendous amounts of anxiety. And, in addition to other remedies we can use for that. But generally speaking, if I use 24, I don't use 210. If I don't use 24, I probably may use 210 if we're looking at an emotional aspect that is presenting with the patient's presentation. So this is one also that it doesn't have to be limited, as you see, digestive, endocrine, cardiovascular, nervous, and you could add every other system in that particular arena also. 226, as it suggests, digestive health where, one of the keynotes, like with Unda 4, is there's this heaviness. They just say Christmas dinner, but it's not Christmas type thing, or they Thanksgiving dinner, and it's not Thanksgiving, or it's the 4th of July or Canada Day on July 1st, where you tend to overeat and overindulge yourself. 243 is, we at times have talked about standalone remedies. This definitely could be a standalone remedy for overindulgence, whether it's overindulgence in alcohol, overindulgence in food. It's the par excellence remedy for liver support. As we'll see in a sec, it's sort of part of the, we can call it a detox aspect of things, or a component of supporting significant amounts of drainage. So, if you were going to a party and saying, oh, there's going to be foods there that I don't know about some of those foods, my food sensitivities, should I eat them? It's a potluck. If you actually take 243, you may help from the aspect of mitigating some of that, because for all intents and purposes, Unda 243 is incredibly effective for increasing the metabolism of what you've just eating. In fact, you can metabolize things rather quickly using Unda 243. 295 is, as you see, digestive support. If you remember when we spoke about it previously, we talked about it from the arena that if there's particularly if you have thyroid issues and GI issues, whether it's a constipation issue from the thyroid or just they have a thyroid problem, regardless of any GI issues, this is a great remedy to use in that particular case. So that's sort of the quick overview of those remedies. If you've one of the people who purchased my book, you'll see a lot more detail about the remedies themselves. If we look at slide number 12, we can look at it from the specifics, because these obviously are also GI support, specifically related to the digestive system, the hepatic system, with liver, and 1 and 13 are critical for that. Unda 1 is both GI and kidney, so it's a great starter remedy. It's not too intense. It's a great remedy that can easily be given to children, versus Unda 13 that has I would say, a deeper action. It is a deeper action, and I will say is more for somebody who has been around longer, so an older person perhaps, who is in a place of having more buildup of toxicity. Unda 20 is one of the deepest acting remedies. You'll remember that's probably the only remedy, I believe it is the only remedy that has 4 metals in it, which means it's definitely, it takes a big scoop when you're digging into somebody's, detoxification system. We mentioned 74, 226, 243, 258. What's the only thing I'll mention about 258 is you consider that to complete the catabolism of anything that hasn't been catabolized. So whether that's a food, whether that's a pharmaceutical, whether it's an herbal, whether it's a pesticide, whether it's an insecticide, if somebody is particularly if they're of the psychotic miasm and do not have great ability to eliminate, this Unda 258 has the ability to further complete the digestive process and break things down. So it's, as a result of that, it's a very important detox remedy, that we would use in concert. So, this is a common one, and, in the middle of that slide, you see my little overlapping triangles, and, when I was still teaching up in National in Portland, and was in the clinic 3 times a week working with students, this is, I would have them have that picture. I said every time if you approach a patient with the idea of trying to understand which organ system, you'll be much more successful when deciding which of the organ systems should we be using in this particular patient. So when we look at, we know that, of course, lipids, everybody thinks about it from a dietary perspective. However, you and I know different that 70 to 80% of our lipid numbers are actually not related to our diet, but are simply a function of survival. It's a function of what one of the probably 500 functions that the liver is responsible to. Remember when these numbers were named in the 1920s, at that point they realized that the liver had 243 functions, so that's why they named it 243. We now know that there's a lot more functions than we knew 100 years ago. So the liver is making most of our cholesterol. We know that stress is a huge component of LDL, and instead of perhaps thinking about, what is the right prescription to lower somebody's lipids, we first want to make sure that their liver is functioning optimally, because if it's overproducing with the idea of protection. High lipids is not necessarily a sign of an imbalance. It's a sign that you need some form of protection. If we look at one of the functions, of course, we always talk about LDL. Let's go back a slide. If we talk about the function of LDL, what's the function of LDL? Well, it forms the plaque. It plugs the hole. So, you know, for example, if somebody is really uptight about having their blood drawn just to find out and they're anxious about, oh my gosh, what are my lipid numbers going to be? That's going to raise their LDL, because it's a physiologic reaction that the brain thinks that you're about to enter a huge stress situation, says you're about to be attacked, maybe you're going to start to bleed. Let's pump some more LDL into the system so that we can plug the hole, so that you won't bleed to death. So, I mean, if we go back eons into genetically, you know, what's the purpose of LDL? That's the purpose. They couldn't go to a hospital. They couldn't go to a doctor. They couldn't get stitched up. They either put a bandage on it and some leaves and wrapped it and hoped they didn't bleed to death, or unfortunately they did, or they pumped out LDL to try and plug the hole. So Unda 1, Unda 20, Unda 243 is a great starting remedy, especially if you're new to not saying, I'll say it again, you do not have to start every case that you see with 1, 20, and 243, even though that is a great opening, I'll call it an open volley, an open prescription. I mean, my first months, perhaps year, this was a common prescription, but now that we use basic treatment guidelines on every patient, that starts a lot of the drainage process. That isn't always necessary, but on somebody who is has quite a lot of challenges in multiple organ systems, and you're uncertain where to start, here's your prescription, 120 and 243. Or in some cases, you may choose to do Unda number 2, as we talked about when we talked about the renal system, 20 and 243. If you're just starting off with a patient, I would not suggest you use Unda 13, even if they have a lot of toxicity, even if they've had a lot of pesticide chemical exposures. Unda 13, you have to make sure, remember, you want to make sure when a person starts Unda numbers that their 5 primary emunctories have some semblance of working. If they're all clogged, and many times they are, giving in even Unda 13 will have a tendency to create more aggravation. Aggravation from the aspect that you're upregulating their systems, their homeostatic systems too rapidly, and they can't eliminate as fast as you're dumping out this toxicity out of their system. However, if you're confident, you know, that the patient is compliant to basic treatment guidelines, then you indeed could start with number 13. Or if they've been a patient for you for a while, or if perhaps they're doing a concurrent acupuncture where one of the functions is to get your lymphatic system moving, then it would be fine. So we see 258, once again, from the aspect of breaking down things. So here's a very common wellness and general health support, and on slide number 15, as we just said, 120, 243, adding blackcurrant bud, which is Ribes nigrum in the GEMO form. That's a great starting little package that you can give to, and I would say safely, to virtually anybody. If you're dealing with a pregnant female and you're unfamiliar with that, you would want to be very cautious. In fact, in pregnancy, the specific thing that I do not do is specifically try and do detoxification, even if we know that that may be an issue. That's why I like to spend a year in preparation before the woman even gets pregnant. But we know that sometimes it doesn't happen because she comes in and she's already pregnant and she just wants some support of some type, maybe some B vitamins or whatever. So when we look at, in addition to Unda numbers, we have on slide number 16 lots of supportive remedies that we can give people. And obviously this is a mix and match, so in addition to the Unda numbers that we just talked about, it's not an unusual prescription. If we look in on the left side where we're looking at lipid metabolism support, the betulopubescence blood and Olea Europa as olive, or just the phytogen, the single phytogen olive young shoot, or MetGen as a combination phytogen. So I commonly do with my patients, I do the 300 numbers. Depending on what else is going on, I can use a gemotherapy, or maybe I'll use a phytogen. Maybe, and usually if I'm using it, it's usually if I'm not using the numbers, which happens on rare occasion, I may use 2 gemos. So I do a lot of mixing and matching, for whatever the specific situation is when we end up doing that. But if we're specifically dealing with lipid metabolism, in addition to the obvious, which is basic treatment guidelines, I'll show you a case in just a sec of what can happen pretty rapidly with pretty simple intervention for a person. We also see on the right side of slide number 16 some additional supportive remedies. And I'll just make a comment about the organotherapies. You see cardinum, which sounds like cardiac, which indeed it is. So all the organotherapies come typically in a couple of different, 3, but for the most part, I use 2. I use 4-CH for the most part, 95%, 99%, and there is a 7-CH, but that's really just sort of like an alternative, and it's like I don't need to use it as an alternative. And there's 9-CH. 9-CH is for downregulating an organ, hyperthyroid, hyperparathyroid are probably the 2 most common ones. We would use a 9-CH. But 99% of the time I use 4-CH. These remedies, of course, are all available from Genesta and from Seroil. And I do it in pellets. They can come in like in a little tube. And if we come in pellets, we do it at 3 pellets 2 times a day, like any other homeopathic, away from food, 15 or 20 minutes. If they come in drops, which this is my preference because that's all we had when I started 20 years ago, and so I've always just continued the drops. So I do 10 drops twice a day, or if they're in pellets, 3 pellets twice a day. We also have gammadines, we have tissue salts, we see nat sulf, we have a couple more gemos, and the fraxinus and the prunus amygdalus, which is almond. We have cholesterol-inomplex. Cholesterol-inom is also in Unda 243, which is why that's part of this support for people with lipid issues. And then crabapple for female hormone support. So mix and match when we get into cases like this one. So here was a 37-year-old, and I remember this gentleman well. He came kicking and screaming because he didn't want to be there. He's 37. He said, I've done nothing wrong. I'm all great. And so like, well, why are you here? And even though he had these issues, fatigue, inefficient lipid metabolism, and some glucose issues, he didn't think that they were an issue. He's 37. He was an athlete, but he came because his wife had pretty significant health issues, also around in her mid-30s, and she had had dramatic results. And after seeing her for some months, she literally said, you got to go and see Dr. Tom. I have nothing wrong. So he sort of sat there like this with his arms crossed, and I said, oh, this is going to be an interesting compliance one. But anyway, interestingly, just before he had come in, he had done some lab work, an annual PE with his, and I apologize, these are American numbers, not the Canadian numbers, apologize. But you'll see what the difference is. So we did that very basic plan. We did BTG, says, once again, go back and review session 1 if you don't remember what those are. Did garlic and parsley 3 times a week. We did fish oil 3 times a week, capsules. We did GTF chromium, just 1 at lunch. And we did Unda 820 and 243. And literally, just, 2.5, 3 weeks later, he repeated the numbers because of something for insurance or whatever. And you look at the difference, what happened in 3 weeks. His total cholesterol dropped 11, 29, 40 points. His HDL went up 10 points. His LDL dropped 51 points. His ratio dropped from 5.5 to 3.6. His triglycerides basically went to half. That's a 3-week protocol in somebody. And, you know, my concern always with him was, are you going to do this? And he, even though he sat like this, he said, I'll do it. I don't believe it, but I'll do it. So you see 17 days later. So, you know, would I normally test somebody in 17 days? Absolutely not. It just was circumstance of why it happened that way. But he totally became a convert. He became one of my star patients, you know, from the aspect of referring patients, because he became a real believer. In fact, his wife and him so embraced the anti-inflammatory diet. They basically went out and got it into their community, their church community. They were true believers, and they truly were superstars as far as the compliance. You know, people ask me about heavy metals. Is heavy metals a problem? Do I need to do chelation, or should I do chelation? So now that we know about the G lymphatic system in the brain since the last 5 years, 2015, you know, it's like, oh, maybe now that we know that there's congestion up there and that's having a major impact, especially when somebody has heavy metals, it's important that we have an understanding of that. And, you know, I always say, well, can Unda numbers remove heavy metals? And once again, we don't treat heavy metals, right? That's not what our purpose is. All our purpose is to enhance the G lymphatic as one of the detox systems, to enhance all the other organs of elimination, to enhance all the other emunctories. And surprise, surprise, what happens when you do that for a while, you'll start to see that the numbers go down. This, I think, was an important lecture that I heard from Dr. John Hibbs, who has been teaching at Bastyr University in Seattle for 30-plus years. This is, you know, it's like 3.5 years ago at the conference. And, you know, he, from studying that, it's like, oh, should we test everybody? And so he, through his own, and this is basically what he presented, you know, who should we test for heavy metals? And he said, if you want to consider that, the first thing you should do is just check lead levels. If you want to consider that, without saying, well, let's do chelation, let's provoke it, et cetera, which can be traumatic for somebody. And he says, if your numbers for lead are less than 1 micrograms per deciliter, he says you're not going to need to do chelators on those people. If you have chronic kidney disease, is much worse if you know, if the serum blood is greater than 1.1. So if the blood is between 1 and less than 4.6, he said at that point you probably want to consider some form of a challenge. But I've done this on many, many people in the last 3.5 years, and 99% of them do not have lead levels over 1. Even if they've done a hair analysis, even if they've done the so-called provoked, it's like, in other words, do we really need to put them through 50 chelation therapies simply to try and lower it, because we really don't have any good indicators of, you know, if one person has a number 50 and another person has 10, does that mean that person is 5 times more toxic in heavy metals? And in fact, the reality is we don't know that specific information. So I use this, and I'm not suggesting, you know, that there isn't a place for chelation, there isn't a place for a standard provocation, but in my particular case, I found measuring heavy metals and something, well, you know, I had all these mercury fillings removed. Do I have mercury still in my system? Or I still have all these mercury fillings in my mouth. Should I get them all taken out? Well, let's see, first of all, whether your body can eliminate if the dentist does do the proper way of removing those types of things. So we have lots of information. We have lots of different remedies on slide number 21 that you mix and match if you are doing. And, you know, it's not part of this particular presentation, but, you know, I have a case of a woman who years ago who was concerned. She had some issues, obviously. That's why she came in. She had spoken to one naturopath who had presented the whole idea of provocation. Let's find out what your heavy metals are. Let's do a bunch of chelation IVs and then some Myers after that, and we'll sort of see how you do. And she wasn't sure if that was the approach she wanted to do, so she came and talked to me and said, do you do that? I said, no, I support that, though, if that's indeed what an issue is. And she said, so what do you do? And I said, well, we're just trying to get your physiology, biochemistry, and physiology and physics to work better. And so we did that, not really dealing on heavy metals whatsoever. However, she had a test done. She brought it in, and sure enough, she had high metals. She had high mercury and high lead and a bunch of things. I said, well, we're not going to treat that. We're just going to see how your physiology takes care of that. And we used some of the remedies that are listed on this specific slide, in addition to the Unda numbers. And at some point later on, she said, well, what's happened to the metals? And I said, well, do you want to do the same test again? We did. And surprise, surprise, the numbers were all lower. In fact, they were all within a so-called, if you can call it a reference range, it really isn't a reference range, but within a reference range according to the lab. The metals had disappeared out of her system, and I said, well, that's what's supposed to happen. When the body is capable of removing things, it will get rid of them. When if it feels that dumping mercury or lead or aluminum or cadmium into your organ system, and then the liver says, what the heck is that? Let's put that back in storage. We're going to basically never lower the levels. And it is known that chelation and provocation only tells you whether you can eliminate it or not. It does not tell you what the levels are. And if you really want to know that, you'd have to biopsy the tissue and look in the tissue, to see whether or not it's in the tissue. And we're obviously not going to do biopsies of the brain or other organs from that perspective. So it's a mix and match of those, all those different types of remedies. So talk about, the specific aspect of IBS, now / SIBO, where there's a huge overlap. Even, Dr. Seebecker, she's still teaching the courses on it. I'm sure many of you by this time have taken a number of her classes and are very familiar with that. It's a real thing. There is an overlap. We can look at, now the June 2004, what the American Gastro Association said about testing people who we think have IBS, and in the absence of what they were calling alarms or red flags, which is symptoms onset after 50, severe and relenting diarrhea, wakes them up in the middle of the night, they're losing weight, not intentional, they have bloody stools, and they have a family history of some form of chronic GI issue. In the absence of those, treat them as if it's irritable bowel. If they have any of those, then you need to do further investigations. And then that was further, and so the symptoms that were looked at by the Rome 3 criteria in 2006 said that, you, in the previous 3 months, associated with 2 or more of, they feel better after they have a bowel movement. The onset is associated with a change in frequency and is also associated with a change in the stool appearance. So they have altered frequency, altered form, altered passage. They may have to strain, or they feel incomplete. There's mucus associated with it. So, you mix and match those 2 things, and you decide whether or not it's truly IBS, or in many cases, SIBO. And we know that SIBO is, for all intents and purposes, it's the translocation of small intestine bacteria into the large intestine. And you step back and say, well, she gives an excellent lecture. She was one of my students many years ago. In the last 10+ years, 15 years, that's kind of been her focus. And there's lots of ways to support that. And so I don't treat SIBO. I treat patients who have SIBO or have been diagnosed with SIBO. I don't diagnose them with that, but I'll say, we have to look at the reasons that somebody has that, and we look at the same remedies that we just went over on that previous slide, and some combination of the remedies that are on slide 24, believe it or not, in my case anyway, have had, in a combination with these specific supportive remedies, have proven to be quite successful. And, I know everybody has their specific approach. We do know that there is a migratory motor complex issues, so then we say, well, okay, if there's a motor complex, we should really be treating the nervous system instead of the GI system. So, you have to somewhat change your thinking and try and get to what's truly the underlying, we'll call it the etiology or the cause for what's going on. And yes, we need symptomatic relief. We want the patient to feel better in order to ultimately get there. And if it truly becomes a motor complex, in my particular case of patients anyway, I would say when you start to, after you get some palliation and they start to feel better, and they say, well, do I have to keep taking these things forever? I said, well, we've got to the point where you feel better. We haven't really addressed yet what the problem is, because we haven't addressed the problem. We haven't addressed why do you have a motor complex problem. We have to look farther upstairs. And if you have a motor problem, what's going on in the nervous system? What happened in your nervous system? And what my personal experience has been with those patients is, okay, let's look farther back. Let's look into, depending, it doesn't matter what their age is, but what do you remember about your college years or your teen years or your, when you were in grade school, or even what do you remember, if anything, about toddler? What do you know about that kind of things? What were your health challenges? And often, in my case anyway, that's where I find the true root of the problem. And that initiates a whole different set of an approach for dealing with somebody with this type of an issue, because obviously when we are dealing with something as problematic as irritable bowel, we know that a vast number of patients who go and see a gastroenterologist, this ends up being their diagnosis, and they realize they couldn't do colonoscopies on everybody, so that's why they came up with these criteria. If you don't have those, let's just assume it's IBS, and they'll do symptomatic relief, take fiber, and and some type of an anti-anxiety medication if it's a stress component. So we'll use these. And are these remedies that are on slide 25, are they curative? Well, no, none of these are curative, because we don't cure things. The body cures things. All we do is we facilitate the body's ability to change the physiology, biochemistry, and the physics within their system. That's where cure comes. If you're able to do that with the support of these drainage remedies, homeopathics, nutraceuticals, you will find that the patients indeed, and once again, this is not a sprint. This, unfortunately, is a marathon. It took them for however old they are, years to get there. It's not going to take that many years to reverse it, but it's not going to happen in days or weeks. Most of the time, anybody who's coming in with a chronic problem, it's going to be an ongoing type issue. So here's a 50-year-old female who had some GI issues. Her gastroenterologist suggested that she had colitis. She was given Asacol 5 times a day. The last few weeks, she was taking 10 times a day. Just a note, when a patient is taking a medication, it doesn't matter what medication it is, it doesn't matter what organ system they are, I don't touch it. I don't make any recommendations about stopping or increasing, that is not my criteria. I'm not treating patients who are Asacol deficient or any medication deficient. However, in respect to the doctor who has prescribed that, because we are trying to get some palliation relief, obviously the patients who generally come and see us are saying, do I really have to take Asacol 5 times or 10 times a day in order to get relief? And if it's providing you some relief, well, keep taking it, because we're not going to get instant turnaround. We're not giving Unda numbers or drainage remedies to say, oh, this says you can stop your Asacol. No, not at all. And that's not what my goal is. The goal is that they will find that in time they don't need to take it. And they'll, when things are stable for weeks or months, they'll say, do I really need to take it? I'll say, go and ask your gastroenterologist or whoever prescribed it whether you need it, and let them make the decision. From my opinion, I'm not dealing with your medication, so I don't worry about the aspect, do I take people off? I don't. So, and do the remedies work? Absolutely. That's one of the greatest things about it. We make them more efficient. So whatever medication they're on, you just keep checking. Blood pressure is being a common one. Probably the medication that I've seen the most where people are no longer taking it, and I didn't take them off, is hypertension meds. They get to a point that their blood pressure is like 110 over, 60. and they're getting dizzy when they stand up. And I said, wow, maybe that medication, you should check with your doctor whether you really need to take it. The patient may decide to stop it on their own. That's their choice. It's not up to me to make that decision for them. They'll ask me if I should, and I said I can't make that choice. But if you're getting dizzy, sounds like you may be taking too much medication in addition to your physiology being imbalanced. So that's how I personally approach this idea of what do we do with people who are taking medications. Anyway, sort of a side note. So lots of canker sores, which we know is one of the corollary symptoms that are associated with colitis. Green mucus, bleeding every other day, many loose stools, bright red blood. She had a stressful conversation with her mom, and she had an episode of diarrhea in a restaurant. She's lots of food sensitivities. These are the patients that's like, oh, what are you eating? So it's like, should you check them for food sensitivities? I don't check them because they're going to be sensitive to everything. Because you're not looking at truly a body that's in any form of balance. So it's under attack, and when the digestive system is under attack, it's going to say, whoa, 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 it's going to react against everything. So I really think you get a lot of false positives in those particular cases. We know that she's a lot of stress. Her energy is not very good. So, the first visit, BTGs, which is for every patient. We gave her glutamine. I like the glutamine powder. Is it 3 or 5 grams per scoop, a couple of 3 times a day, some herbal GI just for soothing. Remember, we're not curing, we're just palliating here. Lipoic acid. Lipoic acid, just a special note, there are some patients that do not tolerate lipoic acid well. It actually will cause them to have reflux. So be mindful of that. Nausea is another common one. And of all the nutraceuticals, it's probably the most common one that I found where people will actually say, and something's not right. They may not know what it is, but now that I've seen it enough, I'll just say stop the lipoic acid and see if that improves, and 9 times out of 10 it does. So we did Unda 3, Unda 48, and Unda 50. 3 times a day. We could have called this acute. We could have done it 6 times a day, but I know, she's on Mesical many times. It's like, why take it 6 times a day? She's already taking something to try and help that dysophy. Ficus carica is sort of like Unda 24. So put Unda 24 beside Ficus carica, and if you're going to use a GMO, if you're going to use Unda 24, don't use Ficus carica, or 210 for that matter, because there's a huge overlap in how their function is. So that's why you wouldn't see me, even though I could have given her 324 and 50, which would have been a perfect prescription for her, but I used the Ficus carica instead. And that salt, it's a tissue salt, is for just all kinds of digestive problems. And I like doing flower essences, and so, from a stress perspective, and so that's what we did. Her second visit, once again, typically is about 4 to 4.5, 5 weeks later. Stools are mostly formed, but occasionally still loose, some blood on the toilet paper, but none on the stool. The acetol is dropped to 3 times a day. Restless sleep, her energy has improved a little bit. She's craving more variety in her diet because obviously it's very restricted. I do a very simple diet, nothing it's very bland to try and minimize any type of flare, and her high levels of stress continue. So continued the same nutraceuticals, but in this case we altered the specifics. Unda 13, once again, it's a little bit deeper. Here's Unda 24 because I'm not doing Ficus carica this time. I'm doing Vitis vinifera, which is a chemotherapy, specifically when there's an autoimmune component, when we're trying to decrease these antibody, these globulin complexes. Vitis vinifera can be used now that we know there's more than 80 autoimmune conditions that people present with. Vitis vinifera, somewhere in their protocol over the time that you are managing them, will very likely be at least 1 or 2 months in your protocols. And that's all. So 24 we know about. 295, once again, you remember I talked about if there's any type of a hormone issue and this, and GI issue. So that's why I used 295 in that particular case. So, once again, later, no GI for weeks, but she had loose stool, lots of bloating. Her diet still is too restricted, but her sleep is better, energy is better. She added some energy work to try and find her center to try and cope with the stress. So Once again, we are mixing and matching. Glutamine is the same. Got rid of the lipoic. This time we put in some herbal bulk because of the loose stool. Did Digest Plus to just try and help the digestion. Once again, we're not looking to cure it. We're looking to change something that's underlying this. 18, 50, and 243. You don't see an organ remedy there. There's no number between 1 and 13, which I appreciate. So this is the mix and match ability that we have. Ligustrum vulgare is another gemotherapy for a lot of GI. Crohn's is another one that works well for celiac, colitis, gluten sensitivity. Ligustrum is a reasonable remedy to consider. Here we see Nervinum vagum 4CH. Once again, it's a homeopathic remedy in a 4CH. Soroil has those in pellet form or in drop form. 10 drops twice a day if it's liquid, 3 pellets twice a day if it's in pellets. MNCU is the gamadine for dysbiosis. As the Menetier basically promoted in the 50s, and perhaps even earlier, he was a French homeopath. That's really how he treated all his patients. He was a homeopath, treated all his patients with gamadines to see what they would do. This is the one for psychosis miasmatically, which is also the miasm of dysbiosis. And here we have Natmer, because Natmer is both from homeopathic, but this is a tissue salt, is a very, very grounding remedy. It's very supportive of the kidney. And the kidney, of course, is what we need to calm things down within the system. So we're going to move to the next system, which is the respiratory system. Lungs, and that's obviously coming up recently. And here we have on slide 35 the idea of the organs, the functional remedies, the drainage complexes. Number 5 is the main remedy of note here in general, because it's for any type of a respiratory problem, from common cold to pulmonary fibrosis, whatever, anything that's going on, COPD, anything that's going on within the respiratory system, this would be your organ remedy. We know that 14, 15, and 16 are sort of their own group. They fit into their own group. These happen to do with their more degeneration that we have spoken about. You should go back and review when we talked about those, back in one of the earlier sessions. These can be used also not only in the respiratory system because they are miasmatically related, specifically to the tuberculinic miasm. They can be used in patients not only who have the tuberculinic miasm, but they can be used in multiple systems in addition. Unda 15, we know, is one of the remedies that's used when we want to optimize the temperature fever-wise, whether it's too low or too high. Unda 15 is often put into the prescription to try and support that. Unda 16 is, while we tend to look at it in the respiratory, has a huge remedy for the endocrine system. So it's used in virtually every endocrine disorder there is, from infertility to dysbiosis to menorrhagia and menopause, and so all menarche, all ends of the spectrum. 16 becomes an important remedy there. In the functional complexes, 19 is probably your deepest acting remedy, the most degenerative components within your lung. Once again, the COPD or pulmonary hypertension, pulmonary sclerosis. 27 is an acute remedy for URI type things, so it's an immune support remedy. You have a nose or sinus issue, the supportive of that. 32 is a spasm remedy, not only in the lungs, but spasm anywhere. You could use 32 for spasm, for a calf spasm or Charlie horses and that type of thing. 32 and 35 are typically used when you have bronchoconstriction that's going on to support that. We'll see that in the case. 37 is the so-called immune Unda number, on whether it doesn't matter what type of a microbe, whether it's a bacteria, whether it's fungi, mold, the virus. Unda 37 is sort of used in that particular component. It's it's not just for one or the other, it's for any type of a microbe. 220 is, once again, for often bronchospasms. 312 has more to do with the throat. So somebody who has a, sore throat, and sore throat, once again, you have to treat the right system. Sore throats are not always respiratory. Sore throats are often from silent reflux. So if you treat the wrong system, people say, oh, I took 312 and did nothing. Well, every time I hear that, I think you probably are managing the wrong system. So, and it doesn't mean that you're going to have perfect success every time, because I've done over 100,000 of these combinations of prescriptions for people in every different aspects. And, do I get it right? I got more wrong at first than I got right. But, you start to learn that it's really about the organ system. It's how I learned that. As opposed to the symptom for which we're attempting to, the patient is treating. And the 710 is these closed spaces. In the respiratory system, of course, we're talking about tonsils, we're talking about sinus, we're talking about cavitations in teeth. You can also be talking about in the brain, an emotional thing that the person can't get rid of. You can be talking about, in the appendix and the gallbladder and the prostate, things that are hard for the body to get rid of. 710 is a remedy for that. I mostly use 710 for the emotional aspect, and it definitely opens some doors for people's emotions. So it's not uncommon that people come back. I'm not talking acute. You can do it for acute things, but this is a patient with a chronic problem. They often come back and say, well, I don't know what happened, but every single day I was breaking down. I was crying at the drop of a hat. It was just like, oh my gosh, the floodgates just opened, per se. So here we saw our little picture again in the middle. Respiratory seems common. We have somebody taking an inhaler or somebody who has shortness of breath. What are we attempting to do? We're attempting to figure out which organ system. I just went over all those remedies on slide 37. We have these additional supportive remedies. If you're looking at anything within the respiratory system, we have supportive GEMOs, the ABs alba, ulna glutinosus, Corylus alveolana, Ribes nigrum, all the gemotherapies, and then the hazelbud and the pulmogen or phytogens, supporting something perhaps that's going on within the lungs themselves. So in addition to that, we see on the right side, we see pulminum, 4CH for supporting that. But don't give the organotherapies too soon if you're trying to restore something, because if you're going to clear something out, you don't want to be rebuilding it. You want to get it out first. You don't, if you're going to remodel your house, you just don't tell the carpenter to come in and say, well, put new kitchen cupboards in. It's like, well, let's take the old cupboards out first before we can put the new ones in. So you got to get rid of the debris before you can rebuild. So yeah, depending what you're doing with the specific organotherapy, these may not be used for several months until you feel okay that you have the ability to sort of start rebuilding things that are going on in that particular case. Some additional respiratory support, we see some immune support. As we all know, we have a vitamin A, we have antioxidants in the Oxy formula, B vitamins, of course, scorbutate and vitamin C, and then tissue adrenal, TAD+, tissue lung for TLU. So when we have all these supportive remedies, once again, it's always a mix and match. We use one of this and that, and so as Dr. Guinaud taught me years ago, he said, don't just keep using the same thing over and over and over. And that's based on the law of brachyese that was actually presented in France many years ago by the nephew of course I just forgot his name, the person who basically wrote Jules Verne, wrote 20,000 Leagues Under the Sea. His nephew became very much into alternative medicine. And what he found was, in treating chronically ill patients, that if he used the same thing all the time, which is, we can say, let's say a person's on high blood pressure medicine, suddenly after X period of time, it's like, why doesn't it work as well? Well, the body gets used to it. So he found that what he called the law of brachyese, which is small amounts change, sort of keep coming at things differently. And that's how I have found the most success with using drainage is, yes, sometimes we'll go a couple of months, but it's rare to keep just saying, yeah, let's keep, with the exception of things like B vitamins, HMF, probiotics, manganolivores, some basic minerals and things. But the drainage remedies don't go for more than 2 months at the most. I'm mixing and matching those constantly because those are coming at it for a totally different, the nutraceuticals are sort of giving you some building blocks, but what's doing the work is the Unda numbers and the drainage, because that's changing the physiology. All we're trying to do is supply some deficient, let's say, minerals. We know that 75 to 80% of the U.S. population is deficient in at least one mineral, if not more, usually more, depending on how you evaluate that. So we have these additional products that we can mix and match. In addition to, the Drosera, coughs. Rabies nigrum is sort of a generic. It can be used for any organ system. We talked about the Unda numbers, of course. Viburnum lantana is definitely respiratory aspect. The pulminum is, once again, the organotherapy. Lobelia, the herb lobelia, it's often in tinctures for respiratory type issues and type problems. So we have some of these common type problems that we look at. One aspect of that one of the people at Unda shared with me 20 years ago in an acute of any type that he, as a physician, he found was helpful was to use the gammadine copper. So he said, it doesn't matter what the acute is, but give 1 ampule of the gammadine copper 3 times a day for 4 days in an acute situation. And what he taught me was that he said it helps to produce and repair connective tissue, and also helps to form rural red blood cells. So I often will do that. So, we have a box of the gammadines, come in little individual vials, so 1 amp 3 times a day for 4 days in an acute situation. But we also have, these acute remedies. So, 2, 5, 15, and 27 sounds like somebody, has a cold, some type of congestion in their system. We always use number 2. Why? Because Unda 2 is open all the emunctories. If we're looking in the respiratory tree, that's why we use number 5. If you want to support a fever or not, it's Unda 15. And then Unda 27 is, once again, the respiratory tree, because it's immune support for that whole respiratory tree. Watch the dosage. It's 6 times a day, not 3 times a day. This is acute. You take it that dosage for a minimum of 2 days past the resolution of a person's symptoms, because we don't want to relapse. If fever is not an issue, we don't put 15 in. So, we mix and match. 2, 5, and 27 is a very common one. And in addition to that, we can use some of these other supportive remedies that may be put in with the Unda numbers. But generally speaking, in all honesty, for my patient population, since I've been doing this for so long, the patients already have them all. They have their own pharmacy of many of these. They have Defense Gen, they have Immugen, they probably have some vitamin C on board, they have vitamin D on board, and so I don't get a whole lot of acute calls anymore because they know what I'm going to tell them. Take your Unda numbers, take the 2, 5, and 27, take your Immune Gen, Defense Gen. When you go to bed, put on your warming socks. If it's in your chest, let's do a mustard plaster. Let's gargle some salt water, alternating with some probiotics, do steam inhalation or alternating hot and cold. I mean, it's standard, and so they say, well, I'm not going to pay you, $100 to tell me what I already know. So I said, this is what you're going to do, and if you call me, it's what I'm going to tell you to do. I'm still going to charge you, so don't call me. So they don't call me anymore, and they know what to do, in that particular case. So when we look at sinus, which is a common problem, obviously, in our society, so what do we change? We may replace Unda 27 because it's a closed space with 710, or we may use number 37 if we think it's a microbe. Once again, doesn't have to be bacteria, it doesn't have to be virus, it could be mold, it could be a fungus in there. And if patients have had a chronic history of sinusitis and have been given antibiotics on a number of occasions, the likelihood is it's not bacterial. The likelihood it's more a fungal overgrowth, and you may need to support that. And maybe there we'll also do fungicide which is a different remedy, but it's not Unda number, but it's another remedy that we can use in those specific situations. If somebody's having more throat issues, whether they call it strep throat or just a sore throat, tonsillitis, we'll replace 27 with 312 because it's pretty specific for this particular area. But once again, if their sore throat is not due to and it's due to reflux, Unda 312 won't do a whole lot because that's not the root of the problem. You're in the wrong system. We have to use GI remedies. We have to use something like 4 and 43 for the reflux per se. Maybe even 26 in that case. So it's a mix and match. That's really where you need the learning comes. That's where the art of the medicine comes in when using drainage remedies. For tonsils, we could put number 37 in there. So once again, mix and match, but you see the possibilities that there are with sinus. Another thing, let's see if it's on the next one. No. You see the number of remedies and possibilities that you have with respiratory health. It's vast. And, obviously you're not going to put every one of these remedies in your medicinary because you don't need them all. But you'll have some degree of mixing and matching that is supportive for anybody who has any type of a respiratory challenge in their system. And, you'll have to decide based on your knowledge of the patient how well their emunctories work. But we don't worry so much about emunctories if it's acute because the body is already working hard to try and get rid of things. It's why it's producing mucus. It's why it produces diarrhea. That's why it produces a runny nose or, sinus problems or whatever. So you can look at those particular slots, that 46 and 47, from the aspects of drainage remedies on slide 47. Once again, it's important that you always use Unda number 2, even though it's urinary. It's all emunctories are supported by Unda number 2. So we see our common respiratory support, 15, 27, 37, 312, as well as your standard nutraceuticals. One of the phytogens that I like is sea buckthorn. If you look where sea buckthorn grows, it's very interesting because where it grows, you virtually see nothing else growing around it. Why? Because it steals from everything else. It's antimicrobial, whether it's a virus, a bacteria, or a fungus, and that's what it does in its habitat. It's stealing, so it's the only thing that can live there because it's taken everything. It's a very interesting plant. I like sea buckthorn. It's also in Imigen Defense Gen, as well as a single remedy, just the sea buckthorn. So once again, you see some of the standard remedies that we'll use in people who have a variety of different respiratory issues. So we look at this particular case. There's an interesting moral to this particular case that will emphasize what I've been trying to share here. So this patient came in, she's 51, told that she has asthma. She did have asthma, so she had shortness of breath often, happens any time of day. She may have to stop because of that shortness of breath. It's become really problematic going to work, and it was interfering with her everyday life. She was given Singular by her pulmonologist. Nothing changed. She tried albuterol. That didn't do much either. And she noted that it's a side note that she would yawn a lot when she was walking her dog. Gosh, is she that tired? She can't get oxygen in, which with asthma, bronchoconstriction, that would make sense. So she had another appointment with her pulmonologist scheduled the following month. So what do we do for some supportive things? BTGs, some vitamin A for just support on the lungs, some flavonoids. Is this an allergy type situation? CoQ10 we know will increase oxygen because of the yawning. Did 5 because it's lung. 22, and I was starting to sense that maybe there was another component. We know that's not a respiratory remedy. That's a nervous system remedy. And 219, once again, spasm. It's not specific respiratory. It's all systems. Asthma is a spasm. Okay. Corylus is a huge GMO, for the lungs. Pulmogen is a GMO, is a phytogen. And Magphos is, once again, spasm. So we gave that to her while she was waiting, but her asthma still the same. No pattern that she could tell, occurring any time of day. Her pulmonologist thought it was due to allergies, and he did some tests, which he was going to do the next week, as well as a CAT scan. Maybe it's her cat, but her sleep was okay, but her energy was low. Her stress, she felt, was moderate at work. So we looked at that and said, no, okay, same nutraceuticals. What's going on? And so I said, we changed things. 8, what's 8 about? 8's about routine. 8's about cardiovascular. Is there something else going on? 24, again, all organ systems. Is it coming from the stress that's related to this? Because the 2 medications you took didn't do much. So are we in the wrong system? So, you start to think. When somebody takes the medication and it doesn't really do anything, it's like, probably the wrong system, which is sort of the giveaway here. Even though I was stubborn, so I did 34, but I still did viburnum, which is another big GMO therapy for the lungs. MNCO is the gammadine for the nervous system, not the respiratory system per se. Nervinum vagum, once again, 4CH, 10 drops twice a day, and Caliphos is a nervous system remedy. The CT was negative, and our allergy testing was negative. However, the pulmonologist says, well, I think it's still, he thinks asthma was still an allergy issue, but the internist said, well, maybe it's not. Maybe it's nervous system related. She did notice that stress may make it worse because she hadn't noticed anything before until it was pointed out to her. She's waking up but falling back. Her energy was a little bit better. Her stress had decreased that particular month. And in this particular case, you see, we went to basically all nervous system problems. So GABA 700, the cognitive care, we gave her 930 and 210, all nervous system remedies. Acer campestri is a nervous system remedy. Comgen is a nervous system remedy. Nervinum vagum is nervous system. Heavily into the nervous system. So this is the perfect case because when she came back, she was much improved. She rarely had shortness of breath. In fact, she had no breathing issues. Her sleep was good. She was not waking up like she was. Her energy better. Her GI was fine. So the moral of the case, or the moral of the story, is that if we had stuck with so-called asthma remedies, she would not have got better. And then a doctor would say, I did those asthma remedies that Dick Tom said you should do for asthma, but the patient never got better, so they obviously don't work. I can't tell you how many times I've heard that story, and I said, well, I would bet you've looked at the wrong system. You can have asthma-like symptoms from any organ system, So some patients who know a little bit about Unda numbers, because I have lots of physicians for patients who have studied this, and acupuncturists, et cetera, they said, why did you give me kidney remedies? I thought it was respiratory problems. I said, because that's where the problem is. That's what's going to help them the most. So I'll reemphasize, please, please, please spend a lot of time thinking about the organ system that you want to support and want to manage. When we look at the nervous system, which we kind of just showed in that particular case, there's not as many remedies in this group as there was in the GI and the respiratory. We know that Unda number 9 is the standalone organ remedy for any and all issues within the nervous system itself. So Unda number 9 is sort of, and probably besides Unda 20, is the most common remedy that personally I've ever prescribed. I would doubt in the last 30 years I have, in rare occasions, seen any patient with any type of a chronic complaint where the nervous system won't come into play in their journey to recreate homeostatic rebalancing of their entire physiology, biochemistry, and physics. So that's why it's used so commonly, and people are surprised how often they'll use it for, whatever. I said, you'd be hard-pressed to tell me a particular issue that a patient has that somewhere in coursing back up the river, as we talked about in session 1, how do we get back up to the headwaters of the river where this whole thing started without looking at what happened to your nervous system along the way? Was that the one domino that sort of, as we're knocking down the dominoes, it didn't fall down properly, and now we got waylaid and We're going to have to go back and stand that one up so we can knock the rest of the dominoes down in order. And this is the organ system, as you remember from the graph we showed earlier, that is the latest, the longest and mature. Early 20s for females, late 20s for males. So if any of you females are under 25, you unfortunately probably do not have a fully mature nervous system yet. And for any men under 28, you probably don't have a mature nervous. And by that I mean fully myelinated, because the neurons, which are all there, take a long time to myelinate. In fact, the first 3 decades of life until they're fully myelinated. So in the functional complexes, 22 we just saw in the case, 24 we've talked about repeatedly. 30 is a huge remedy for sleep problems, which is another big problem in our society. 41 is for neurological health. It's a deep-acting remedy. 42 is also a very deep-acting remedy. So we tend to use those for manipulation type things, or it's a musculoskeletal issue. 47 is the brain itself. Circulation into the brain is helped by Unda 47. 76 we talked about previously is sort of this overexhaustion, this depletion of the nervous system. 202 is a straight miasm remedy for the luetic miasm. As you see, it's every organ system. It's when you have major depletion within the body and major degeneration, whatever that condition is. 210 we've mentioned, it's like a 24. 212 is a lot when there's been a lot of, there's a specific episode or specific instance where the body is just totally worn out. It's not chronic fatigue worn out. It's fatigue from having a baby. It's fatigue from having surgery. It's fatigue from a major trauma in your life, per se. Different from fibromyalgia, also known as chronic fatigue immune deficiency syndrome, which we don't hear as much about, but believe me, there's tens of thousands of those patients still out there. 219 we know is the spasm remedy. 228 is the remedy for, say, deep grief, patients who may be up and down as far as their moods are concerned. 1001 is a remedy for insomnia, specifically sleeplessness, restless sleep, that type of thing. I don't use 1001 that often, mainly because I'm doing other things, but it's a great remedy. If that's specifically the one issue we're going after and there's nothing else going on, I'll have a tendency to use that. And we know, and we'll talk about here, the importance of what sleep has in our support for patients in order to get them better, and how they're really going to get better, because we know that sleep is critical from how we are able to manage our stress. We know that healing occurs during our sleep process, which is why we really need to sleep. It's not what I wrote up there, it's not the absence of wakefulness. It's really, there's a lot of physiologic and behavioral processes that are going on during sleep. It's recurrent and it's reversible, because unlike a coma, we end up waking up, thank goodness, in the morning or whatever time of day that you're sleeping. So it's an active process. It's incredibly highly regulated. And it's because it's highly regulated, that means that there's a lot of factors that go into getting a good night's sleep. And, the knee-jerk is, oh, take melatonin. Oh, take GABA. Take magnesium. And yes, those will buy you some time. Those will help. But if melatonin is the magic bullet for somebody, you better start asking, but why is their melatonin low? Because shouldn't the pineal gland be producing enough melatonin to be able to allow us to sleep? So once again, if you back up and saying, great, we'll use the melatonin, but if you need to keep using it, we're not correcting anything. We're just basically substituting something that your body is not yet physiologically able to do. So do I use melatonin? Yeah, sometimes. Is it a great remedy? Sometimes. Can it be helpful for people? Absolutely. But in 4 years from now, if they're still using melatonin, then I think you've missed the boat, because you haven't really addressed what their problem is, which is And then if you were to do a CT of their brain and find that their pineal gland is half calcified, as it is in 75% of the elder population, and since it's the #1 regulator of all people's organ systems, you start to realize it's like, wow, I think we missed something here, because why are they calcifying their pineal gland? You know, what are those calcifications? And we know calcifications in the body are a way that the body stores toxicity. So whether it's in your pineal gland, or whether it's in your bunion, or whether it's in a muscle, or whether it's in, you know, some calcification in your arteries, you start saying, why is it calcifying? Because the body is not in physiologic balance. And so obviously sleep is essential to life, and we all need to do it. And it goes without saying that we spend about 25 years, a third of our life, sleeping, which tells you the importance of doing this. And unfortunately, those of you new moms, and I'm sure there's some of you out there, you know, will miss out on about 6 months worth of sleep in the first 2 years of a baby's life. That is a lot of lost sleep to lose that. And how much sleep should we get? Sleeping less than 7 hours reduces your life expectancy. So now it's 7.5 to 8 hours, and people wear Apple Watches, people have Fitbits and all types of devices that now can easily measure that. And if somebody's doing that and you say, well, what's your sleep pattern like? And since, you know, half my patients are wearing something or other, you look at it and you say, wow, you don't get into deep sleep very often. This is a problem because you may feel that you're fine, but why do you feel fine? Because your first stop in the morning is to Starbucks or to Tim Hortons. I said, that's not where you should be getting your energy from. If you're not rejuvenated in the morning, we have to look at what's interfering with you getting proper levels of sleep. The lack of sleep can cause weight gain, you know, almost a kilo in just under a week. So people, how many people do we say, it's like, wow, I can't lose any weight? Well, we know stress is a factor in that because of cortisol levels, but now we have another one saying, you're not sleeping 7.5 to 8 hours. You know, and that may be circumstance, it may be job, whatever. I said, well, let's put it into importance. If you're going to sleep 1/3 of your life, it behooves you to find out how to get your whole system in balance. So we can survive a couple of months, no longer, without eating, not drinking, but not eating. But you can only live, how would they figure that out? 11 days without sleeping. It's like, I mean, it just seems inconceivable that somebody could go that long. So the ability of the brain to tell what's important from what's not is compromised by a lack of sleep. In other words, we know that with the time change, Arizona doesn't change clocks, neither does Hawaii, but most of you will have just in the last couple of Sundays ago experienced a time change, and we know that that 1 hour time difference causes a lot more accidents on Monday morning. So it's 1 hour. So think about people who are constantly having problems with their sleep. So it you know, a lot of your skill in supporting patients is, and certainly some of the understanding of, if you're not getting enough sleep, excuse me. That's what happens when you talk all the time. We need to certainly look at that as one of the key factors in what they're presenting with as far as the problem is concerned. So we do know that people experience better sleep during the new moon and worse during the full moon, which, I mean, many women with menstrual cycles and, you know, different types of their cycle will tell you that. And it's like, it's not an accident. It has to do with, guess what, the organ. It has to do with the pineal gland, which obviously is regulating melatonin as long as lots of other things. So we know that memories hold better, and, you know, what are the functions of sleep? It's to cement what you've seen and learned that day, you know, into your brain, into long-term memory storage, which is why we know that, you know, all of us, when we were, you know, in school and studying, and the ones who crammed, it's like pass the exams with flying colors, but 3 weeks later said, huh, did we ever study that? What happened? We can't remember anything. So, you know, cramming in exams has long been shown to not be a very efficient way to learn something so that you can recall it weeks, months, even years later. Things that got jammed into your memory banks were usually at nights that you had the best sleep. They know, even though I don't know what time school starts, when school will start in your particular area, but here in Arizona, where I am, in the summertime, I mean, the school buses are coming by at 6:10 to pick people up. Yes, it's hot here. Yes, it's 100 plus 115 degrees. They want to get out early, understandably, but that's way too soon for teenagers to be getting on a school bus thinking that they're going to learn something, and we're talking May and June. We're not talking July and August when supposedly school is not in session. We burn calories when sleeping. Isn't that interesting than you do watching television? So instead of watching the TV, go to bed. Read a book. Calm down all those Wi-Fi devices. We know that nightmares can be due to many things. It's like, well, why do I have a nightmare? For what's going on. We know nightmares are usually stopped at age 5, and that's because the child's brain is much more biologically active. Sleep deprivation affects the brain, as we said, in many ways. It has a huge impact on your judgment, slows your reactions, increase accidents potentially. A baby's brain can use up to 50% of the total glucose supply, which is pretty amazing. I mean, how physiologically active the brain is for that component. Drinking caffeine in the evening delays our release of melatonin. So people say, well, I can drink, I can go to Starbucks or Tim Hortons at, 8 in the evening or 9 in the evening, or have a big cup of coffee with dinner. I said, well, maybe you can, but it's going to affect your circadian rhythm because it's going to affect your production of melatonin and your winding down, et cetera. So you have to put all these things, into the big picture of what we're doing with supporting patients. Maybe not the first visit, maybe not the second time you see them, but in the big picture of, when we look at the 30,000-foot view for people, it's like, what are we really doing? Are we just treating a particular symptom, a particular condition? Or are we really trying to reestablish long-term patient care so that the person's your patient forever, which has always been my goal. It's like, if you see a person, as long as I'm practicing, and they're, willing, they should be basically be coming in at some point, whether it's as infrequent as once a year or as frequent as once a month. We basically need to support that. So we know that, in childhood, ranges up to 18 hours a day for babies and 9 hours a day for teenagers. Yeah, teenagers may sleep till noon. It's like, if they're sleeping till noon, what time are they going to bed? They shouldn't be going to bed at midnight because they're totally upsetting circadian rhythm. You're totally upsetting melatonin levels. You're totally upsetting growth hormone, which is how they heal. You're totally upsetting their cortisol levels. You don't heal real well when you so upset your endocrine system. As an adult, 20 to 40, you see that it drops a little bit. Unfortunately, the menstrual cycle will have an impact. Pregnancy has a huge impact, as well as, of course, the cycle itself. Middle age, so 40 plus, we'll say, sleep often is lighter, and nighttime awakenings become more frequent and will last longer. People say, is that what should happen? Well, that's part of that. That does happen. Now we can say, is that normal? Well, we'd have to go back into caveman days and say, well, when a person slept in a cave, didn't have lights on, didn't have all this Wi-Fi stuff hanging out around us, did they sleep? Did they wake up during the night? Of course, we have no way of knowing that. They often wake 3 hours after sleep, and depending what time they go to bed, which ideally is between 10 and 11 at the most, 3 hours after bed, meaning they're waking up in the Chinese clock in liver time. The liver is physiologically the most active. There's a lot of things going on there. We said 243 and 100 years ago, and hundreds more physiologic functions. Maybe the thing when you're treating somebody with sleep problems is not to worry about melatonin and GABA, but rather let's support their liver. Let's support how we can, with nutraceuticals, with Unda numbers. Maybe this is a liver issue, their insomnia, which is why I always say you have to look at the organ system, not the symptom of what the patient is presenting. Of course, menopause can lead to hot flashes. You say, well, why do we have hot flashes? Is that the imbalance of estrogen? Is it progesterone? Is it the fact that you don't have enough? Do we need to support that? But if it's menopausal, we know that's supposed to be coming from the adrenal gland. So is it stress we have to treat and not worry about the hot flashes? these are all the questions, I'm sure, as a practitioner that you go through in your own mind, and not just the knee-jerk, oh, here's what we do for insomnia. You know, instead of our patients taking Ambien or some other sleep med, you know, which gets people to fall asleep, but many times they'll be somewhat groggy. But we're still not treating the right problem. Breathing problems may happen. Physically active people tend to sleep more soundly than there are people who tend to be more sedentary. So now you have to watch that, however, because, you know, as a fellow Canadian in this case who played hockey as an adult, often late at night, it's generally not good for us to play hockey, you know, at 11 till 12 at night, come home and it's 1:30, you know, because your system is so revved up. So, you know, but you have to figure out for your individual patient when is the best time for them to be physically active, whatever their level of activity is. And ideally, we are going to be dreaming, and a lot of people say, well, I don't remember my dreams. We'll get to that in a sec. But older people, they feel that they have less deep sleep. That's a reality for what's going on. But they're still dreaming. They may have, their Apple Watch may say, wow, you woke up 15 times last night. Falling asleep may take longer. Despite all that, over the 24-hour period, they tend to accumulate the 7.5 to 8 hours because they sit down, they nap. People, you know, how many times have you heard the spouse is always saying, well, as soon as we sit down, you know, to go somewhere, they fall asleep in the car or take a cat nap, or, you know, at 7 o'clock in the evening, they're watching the news or their favorite show and they're dozing off, and well, go to bed, go to bed. No, I'm not going to bed because I won't sleep. So they're more likely to nap during the day. That's an okay thing as long as they have the energy to do what they need to do through the day. So the important thing is they do need the same amount of sleep as when they were younger, 7.5 to 8.5 hours. So even though they're telling you they're only sleeping 4 hours at night, if you look at the cumulative effect when they were getting them into the changing brain waves, that's an important component. We know that many elderly, half of them have insomnia. Women are twice as likely. My mom was the perfect example. She would spend half the nights, and that would freak her out, but then she would sleep 3 hours in the afternoon, and she was all worried. But she always had a great energy. She always was able to do everything she needed to do, and, you know, she passed away when she was 94, so she did fine. Risk factors for insomnia: depression, disability, of course. They perceive that they're not doing well, the respiratory issues, they have lost their spouse is definitely a component of that. So if we don't get enough sleep, a sleep debt is created, which is why we ultimately tend to be sleepy. And that lost sleep accumulates, and there's a larger and larger sleep indebtedness. And if the sleep debt is zero, you're not going to fall asleep. I mean, it's just not possible. If your sleep debt is low, it'll only take, so we'll call that a light sleepers. And if you don't have but if you have a big sleep debt, this is where you basically, you know, the alarm goes off, the fire engines are on the street, the people are breaking into your house, you hear nothing per se because the sleep debt. And, you know, we know based on what we said with new moms for the first couple of years, you know, they hear everything. They hear the baby turns over and they hear the baby, but they get into this sleep debt, and then, you know, as they try and catch up later on, which is a huge component to try and do that, we get into some types of specific issues. So the average human, once again, 8.5 hours. You talked about that. Takes ideally about 10 minutes to fall asleep. The cycles are about 90 minutes. We go through several of them. You see stage 1 to stage 5, which is the REM when we are actually sleeping, and napping occurs, you know, in our culture at different times. So when we get to stage 4, you know, after about 80 to 110 minutes of total sleep time, it lightens and we return up through. I mean, this kind of stuff you have been somewhat familiar with. We know that rapid eye movement, there's rapid eye movement therapy, which is your recurring sleep stages, which where you're really getting your dreams, and you get the so-called paradoxical sleep where your muscles get real relaxed, but your other body systems are active. It occurs in other mammals also. You have pets, I do. They're twitching and moving and crying and making all kinds of sounds. You know, it's like, wow, they must be having a dream, and indeed they are. And we know REM is helpful to consolidate these memories. So these are the different theories that abound as to why we dream. You can pick the one that, you think is the most applicable, but the reality is we all dream, and sometimes it's important for people to write them down to remember them. So if we have these issues, we see sleep concerns are common. Most of your chronically ill patients, it's a problem. They're serious because of all the things we've just talked about. They can be managed. They are often, unfortunately, underdiagnosed. And we know that there's, I'm sure the statistics in Canada, percentage-wise, are similar to what they are. So 95% remain unidentified and underdiagnosed. So that's a huge effect on the healthcare system in both countries. So the perception of inadequate or poor sleep is accompanied by a lot of distress in our system. So chronic occurs on most nights and lasts for more than a month. So, and we see the factors. If it takes more than, 45 minutes or so, if you wake up, can't fall back to sleep, is a big issue if you're not refreshed in the morning. And these are the questions that you ask. If you can only get sleep with sleeping aids or alcohol, this tells you that physiologically there's a real problem. And we know that half of the U.S., which means half of Canada, also have that at least a few times a week during the past year. 1/3 that would say they have insomnia nearly every night, decreases with age. And it's, after pain, it's one of the most, and fatigue, I would say, the 2-3 most common things that somewhere your patients will typically talk about. And it's more common in women. The different people have looked at the different types of insomnia, whether it's initial, mental, terminal, hyperinsomnia, or parasomnia. Does it really matter from what we're doing? We're not treating conditions. We're trying to understand the physiology of why people tend to experience transient, less than a couple of weeks, or intermittent with episodes, or this chronic, which is the continual aspect. So we say primary is not related to other health problems, and secondary, which for the most part I would say is probably, in my patients anyway, is really what the bigger issue is. It's very often not that difficult to try and figure out that it's secondary to some other issue that's going on. So primary, I won't say I never see that, but it's mostly secondary aspects of, we get into this chronic sleeplessness where they're generally less than 6.5 or 7 hours a night over an extended period of time, and taking a fair length of time to fall asleep, or they wake up during the night for extended periods of times, and you can't count it for some other issue that's going on. We know that the moods can definitely have an effect. We know that too much exercise late at night. We know that caffeine, alcohol may have an effect for some people, that it can alter the pattern. Napping for too long and extended, major grief, loss in a life, job loss, whatever, some big stress can definitely have an effect. And we always say keep the room cool. If, we have some people even in the northeast of the U.S. and Canada, where it's chillier in the wintertime, will say they crack the window, because they really like that cool, fresh air, which we know the cooler, the better, typically. We know the temperature should drop, and that generally is a good thing that people are looking for. We know that hyperthyroid won't work. If you have pain, it won't work. If you have to get up 10 times because of a kidney issue, if you have cardiovascular issues or chronic reflux that tends to show up at night, or a variety of neurology. So in other words, any problem on any level can basically relate to that. And so it takes a lot of effort to try and figure out what's going on in this particular arena of things. So these are some of the things you want to look for in this chronic sleeplessness for what's going on. And so, the whole reason that I sort of belabor this point is because I see so many people who have been unsuccessful with using drainage remedies and saying, I tried all those drainage remedies and they really didn't do anything. And then when you start to ask them about it, I say, how much investigation did you do as to really what was the underlying reason for their insomnia? Yes, you need to try and, yes, if melatonin works for a while, great. And if you came back and say, oh my God, this is the best sleep ever, great, stay on melatonin, but we know, is it a melatonin deficiency? Quite likely, and if that's true, why is that true? And we got to go up higher up. Why is the endocrine system? Why is the pineal gland, et cetera, et cetera? So that's always sort of how I tend to think about this when evaluating patients for what's going on. So the medical history, sleep history, and maybe a sleep journal is helpful, or a sleep diary. If they really get to a point doing the sleep studies, and a DO and an MD can order, and at least in the United States, an at-home sleep study, and they don't have to go into the sleep lab and do polysomnography, which is incredibly expensive, several $1,000s to be able to do that. These are the types of things that people can record on their sleep journal, which may help you get a clue. And it's not the type of thing that often you'll sort of have, the answer immediately. They may be taking these type of antidepressants, so it's a real concern when we look at that. Look at the medications that they're doing, and these are medications that typically are tried, and they may or may not be particularly helpful for individuals. You do the obvious, and which I always recommend, to include these types of things in their plan. But I don't say that, oh well, this is the cure. No, this is part of the aspects of trying to understand. Yes, if you're overstimulating your physiology, you probably won't sleep very well. We know that bright light. We know that reading, from a Kindle or an iPad or something. Even people wearing blue light, blockers. That's not the answer. Get that Wi-Fi off. Shut all that Wi-Fi stuff off. Get all the lights off. Don't have any be in pitch black, just like you were sleeping in a dark cave. That's with the exception of day before, day of, and the day after the full moon. Ideally, we'll say around ovulation time for what's going on. So we have all these types of things that are all important, and make it as comfortable as possible. So these are all these, we'll call it the environmental things that you can do to make sleep very helpful and very effective. And so when we do next week's next session, we'll talk about some of the specifics, but I want you to think about, if you have a patient this week that basically where insomnia is one of their key things, spend a little more time and kind of investigate it. And yes, recommend cooling the room and making it dark, and not too many clothes, and don't overstimulate. I mean, all these usual things that I've listed here. But there are definite Unda numbers when you are looking at a nervous system issue. We have some perfect remedies that will work. But often they're not the first thing, because I often find we got to seed the ground first before we get there. All right, so we have a few minutes, so let's get to some questions, Helen.
Wonderful, Dr.
Time, whatever, however that works.
Okay, we'll do our best because there's a lot of questions that came through. So my first question to you is, from the last session, you mentioned about the intake form. Can you direct us where we can go to get that, please?
Right, that's the, several people have asked me, what is my intake form, and if you go on the website, once again, hbbhealth.net, and on the left-hand side under catalog, the drop down, it says PDF. If you open that there, you'll see it says an adult intake. I made it generic. If you want to use it, use it. If you don't want to use it, don't. There's also something else on there that may be of interest to you if you want to download that too. I suggest you have a look at that, and you may find that useful when studying the Unda numbers.
Thank you for that. I appreciate that clarity there. And in regards to next participant question is, in addressing heavy metal intoxication, that is, you mentioned that there is like lymphatic system associated with heavy metals in the brain. Are there any specific Unda numbers that you can suggest to help with this to clear the lymphatic system?
So before you move the lymphatics, of course, you have to make sure that the circulation is working. How do we move our lymph? We do it with castor oil packs. We do it with dry skin brushing. We do it with exercise. So those things have to be in place. We need to also make sure that our GI, because once we start to mobilize these heavy metals, they got to get out. So we got to have liver working well. We got to have the kidneys working well. We're going to be doing our deep breathing. So those are the specifics. And when you do that, you'll probably end up with cardiovascular remedies. One of the remedies also, I mean, there's a couple of gemotherapies, Sorbus domestica and Castanea vesca, that are very strong lymphatics per se. Otherwise, we can use kidney remedies with a combination of liver remedies to support the lymphatics once we're doing those other BTG stuff.
Wonderful. That's a very good answer. Thank you so much for that. And also, could Unda 710 to help to reduce chances of root canal?
Ooh, that's a sticky subject. That's a whole other issue that, you know, as a dentist, and I don't want to take the last 10 minutes to go into that. I'm going to say no, don't go there, because there's a misunderstanding about who needs a root canal and who doesn't need a root canal. I just had this conversation with one of my patients, and, you know, her chiropractor said, no, you don't need a root canal because the tooth's going to heal itself. The tooth, if the tooth has this, if the blood flow into the tooth, which is the most unique tissue in the body, it is the only tissue in the body that has one source of blood, which is through the nerve and vein and artery that come through the base of the root. If that somehow is disrupted, you cannot heal that tooth. You have two options. You take the tooth out or you do a root canal. So if you have an infection within the tooth and you have a disruption of the blood supply, 710 isn't going to help a hoot, because if you can't get blood and oxygen in, you don't heal the tooth. And so many people have made that mistake, that they think they can heal a tooth. That is what we call, it's past the point. It has irreversible pulpitis, is how we refer to it, which is different from reversible pulpitis. So if it's just sensitive to cold, for example, that may be reversible, but if you have a tooth that wakes you up in the middle of the night, or you can't bite down on it, or something hot and you hit the ceiling or the dentist taps on it, that's irreversible pulpitis. You got a root canal or you got to extract the tooth. You can do all the ozone you want, you can do all the vitamin C you want, you can do all the Unda numbers you want. You got to take the tooth out or do a root canal. Period. That's my answer to that. So I'm going to say 710, no. Is it part of a plan if it's reversible? Yes, but if it's not reversible, no.
That's a good one. With your experience, I guess you went through all that. Just very good. Thank you so much. And also, this one clarity in regards to, you mentioned about the 9CH for hyperparathyroid. It's down to downregulate. Can they actually take this actually to help the patient or the person who is actually has the thyroid being removed? Will that help assist?
It depends why the thyroid is being removed. If the thyroid is being removed simply because it's hyperthyroid, this is exactly why you would use it. This would be part of the treatment that you would use in somebody, let's say with Graves, where you have a hyperactive, you know, you have a TSH almost non-existent, and, you know, T4 and T3 are both really elevated, and they're really hyperactive. This is how we down-regulate with a homeopathic remedy, in addition to specific Unda numbers, in addition to specific gemotherapies. So if it's being removed because a person has, you know, cancer in their gland or something, I said, that's not, you're not using 9CH for that. It's a specific hyper situation where we're trying to down-regulate it. And I've had great success. I just had an 87-year-old woman who had been on hyperthyroid for some time, who is now totally off. She doesn't take any medication. Her thyroid has totally regulated itself. That was one of the remedies I used in her case.
Wonderful. Thank you for that answer there. There's one question I had from the last session that someone was asking, one clarity here. What, if you're able to answer this, what Unda numbers should you suggest for a woman with ovarian cysts?
Ovarian cysts. Okay, so ovarian cysts are typically the psychotic miasm because, you know, basically we're looking at, you know, in fact, cysts generally. It doesn't mean it's the only miasm, and we don't associate diseases with miasm, but that generally is is what we're looking at. So we obviously know that there's a hormone problem, and short of not deciding something else, the remedies that I would start with ovarian cysts are Unda 10 because it's the hormone remedy, Unda 21 because it's for balancing all hormones, and Unda 245 because it's for uterus and all GYN, uterus and ovary problems. 10, 21, 245, as well as BTGs, and looking at why this person is not a good eliminator would be how I would do that specifically for ovarian cysts.
Awesome. That's good. Thank you for that. And one last question here before we end the call here. Depends how you can answer this. This one question for today coming from a participant asking about a 37-year-old man who has gout for over 20 years, and he's done drainage for over 3 years, and now that he is experiencing some debilitating pain over 3 months. Is there anything to help to relieve this debilitating pain?
Did you say gout?
Gout, correct.
Okay, so we know that gout is an increased uric acid. So just like I just said with ovarian cysts, anytime you're building up something like uric acid, that particular miasm, which most often is associated with it, means that the person is not capable of eliminating efficiently. And if you're not capable of eliminating efficiently, you're going to be, and some people are more susceptible to this, and they say, well, drink cherry juice, and we can do in the numbers to try, and we can do in the number 2, we can do in the number 7, we can do liver remedies and that type of thing. But more importantly, we have to step back and say, what else in their body are they not capable of eliminating? So in that particular case, I'd say I'd have to look at every monk tree. It would not surprise me if in that particular case, the monk tree that is the most blocked, especially as a man, is going to be the emotional monk tree. And so, however this patient was treated for those years with Undas and saying, it's still a problem, and what is pain? Why do we get pain? Pain, of course, we know is a sort of the doorbell to tell us that something isn't right. So I'd have to step back, trying to understand, why are they getting the pain, especially after this period of time? So we know it's an inflammatory reaction that's going on. What else is causing this inflammation? And where is the pain? Is the pain in the big toe where gout typically is? Or is it somewhere else? Is it a generalized body thing? Does it mean, are we accumulating more, not uric acid necessarily, but more just general toxicity that the body is not capable of getting out? And usually it means at least one of those emunctories is still blocked. So we'd have to look at all 5 emunctories. I would probably change organ systems in dealing with that. Specifically, which Unda numbers for pain? There isn't any Unda numbers for pain until you identify the organ system that you more want to be focused on. There are chemotherapies, the sequence of Sequoia gigantica, Rubus idea, and Vaccinium vitis idea. Those 3 chemotherapies, as a combination, all 3 of them, have been supportive generally in pain syndrome, because they cross many boundaries. So that has been shown clinically to be somewhat effective. Would they be helpful for this gentleman? I really have no idea because there's not enough information from that. But once again, you have to look at the physiology of why this person is a poor eliminator of uric acid for all these years. And I always go back to which emunctory, and the easiest one that's most often blocked, once again, not just because he's a man, he's 37. Truly, what is the blockage? And I would go back into his 20s and into his teens and childhood, say something's going on here that maybe we don't know about. Maybe we need to look at that first. In the meantime, obviously you need to try and give this gentleman some palliative relief, whether that's topical things, with the ointments and creams that we have available. I don't have a magic answer for that, unfortunately, because I deal with those types of patients myself, many, and they're tough because pain affects many things: your ability, your activity of daily living, your sleep, and if you don't sleep, you don't heal, et cetera, et cetera. So, tough question, and I hope it was somewhat helpful for the practitioner who asked the question.
think it was. If they need more clarity, they can reach out to us and get more clarity from our medical advisor. Well, thank you so much, Dr. Tom, for the questions that you've answered. And unfortunately, we are very running out of time. So I'd like to say thank you for an excellent webinar, and thank you for everyone who participated. Your questions will be marked down and will be answered accordingly, if not today, the following, and being pushed over. And if you have any additional questions, please contact your Atrium Innovation representative, and do not forget to take advantage of the 15% off and free shipping using promo code UNDA20 for all of your our Unda number compounds, which is valid until June 8th. This code will be used and can be used up to 4 times if you have not done so. And also encourage you to review the notes. The webinar itself will be available for you to listen to. Go for the cases and review what Dr. Tom spoken to you about the respiratory situations and numbers. Those are really great at this time to use. And please note that recording of this webinar will be available on the SORL site beginning the next Wednesday, April 1st, and will be available till June the 8th. And if you have any further questions about that, want directions, please reach out to us. Your account representatives are here to support you, and also be aware that the medical advisors on staff are also support you as well during any kind of difficult cases you may have. And if you have, again, any questions, do not hesitate to reach out to us. And addressing to the webinar due to time restraints, please contact Atrium Innovation representatives at 1-800-263-5861 for Canada, and in the U.S., 1-888-737-6925. Thank you, everyone, for your patience, your time, and for participation tonight, and have a good evening. Good night.
Good night, everybody.